Okay, good evening. I'm using the microphone not because I think I won't be heard otherwise, but because I'm recording, and that way the sound will be recorded as well. So good evening. Good of you to come. I'm going to give a bit of an update on sort of the horse victims of the Pinery Fire. It's just over 6 months ago now, so it's a good time to sort of look back and see what's happened. When we were treating these horses, there was a number of questions that we had. There's not a lot of literature about the effects of bushfires on horses and treating them. So we contacted a lot of colleagues who had some experience. We read the literature that was out there, and we've gained our own experience through this. So it was a terrible event that happened, but it has been a learning experience. And I think we as a team are better prepared now to deal with something like that in the future. And also we've, in the meantime, been able to help some of the colleagues in Western Australia. Obviously, fairly soon after we had the fires here, there was a fire in Western Australia, and we contacted those colleagues and were able to share some of what we had learned and discovered with them. And I think that helped them to treat those horses. So we'll just take you back to that day, which from our campus, this is the Equine Centre. So the day started like this. It was all looking very threatening from our roof, so we could see the smoke coming. And obviously, soon it became apparent that this fire was going on. It got very close to us. It got to within about 500-600 metres from the Equine Health and Performance Centre. Luckily for us, the wind changed direction when it did. So I think we were next in line. So we weren't involved directly, in as much that we weren't engulfed by flames, but obviously we got to deal with the aftermath related to the horses. So what I'd like to cover this evening, and as I said, feel free to ask questions in between. I'd like to talk about the different types of injuries that horses sustained. So obviously there's the burns, the horses that were within the fire, they had burns, more or less extensive, so I'll talk about those. There's quite a lot of horses that had injuries to their eyes. The feet, or the coronary bands, many of these horses were affected, and that's one of the things that was for us quite uncertain how that would develop. Some of them came in with other wounds, not directly a result of the fire, but something to be taken into account. And obviously the fire, the smoke would have had an effect on the lungs, on the airways. And we'll talk about what happened at the time and about the possible continuing effects of that. I'll also talk briefly about sand colic. We're seeing a lot of that at the moment, and that was predicted at the last meeting we had here. So after the rains, which have now come, that we will see sand colic, and that prediction has turned out to be correct. So obviously, one of the things we were dealing with was the burns to these horses. And if you do read the sparse literature that's out there related to horses involved in fires and being burned, is that you need to assess the extent of the burns and the depth of the burns to be able to give some prognosis. And generally, it's considered that if 30 to 50% or more of the body surface area of a horse is affected by burns, that carries a very poor prognosis, and it's probably fairer to euthanize a horse at that time. And also the depths, there's grades similar to what's applied in human medicine, depending on how deep the injuries are, and that's related to how many layers of the skin are involved. But all of that is very difficult to assess, certainly initially. This is the first horse that came in a couple of hours after the fire, so beginning of the evening. And on this picture, it doesn't look too serious. Obviously, you can see a few areas that have been affected on his chest, on his sort of right hind. But all in all, it doesn't look too bad. Certainly, I wouldn't say nowhere near 30 to 50% or anything. But I'll show you some pictures of how that progressed, and that shows that it's very hard to tell at that initial stage, how extensive or how severe the burns are. So this obviously is on that night, so a bit of a close-up of that right hind, what the burns look like. Then the next day, so not too much change at that stage. Then as we go on, so this is next day, and by now you can see that certainly on this chest, the wound's looking an awful lot bigger, and you can see the wounds becoming, the burns becoming apparent on his face, which initially when he came in, it was very hard to tell that he'd been burnt there. And this is several weeks, just over 3 weeks after the fire, and it took that long for the extent of the wounds to become evident. More and more skin was sloughing off, and we were cleaning it and debriding it. So sort of 3 to 4 weeks after the fire is probably when we could see the full extent of the damage in this horse, but also in some of the others. So all around this is his right hind leg, 3 weeks after the fire, his back end. So there's a lot of tissue, a lot of skin that was burnt, but you wouldn't have been able to predict that or tell that the moment he got in. This is one of the other horses, again on the 18th of December, so just over 3 weeks after the fire, and turns out to be very, very extensive. The other thing that was also hard to gauge was the depth. So grading these burns, I think in horses that's very difficult, because obviously the prognosis depends on the depth of the wounds, and again the deeper, the more severe. That will also determine what components are lost. So hair glands, sweat glands, things like that. We were concerned that the wounds were very deep, that they would lead to potentially some scarring, loss of hair. But I think in all of the horses that we have treated, most of the hair has grown or is growing back. So that suggests that the wounds weren't as deep as we feared, luckily. So the first point is that it takes a long time for the extent of the damage to become apparent. So several weeks, 3 to 4 weeks, based on our experience with these fires. So in terms of what did we do to treat the burns themselves, if you get these horses soon enough, so within a couple of hours after the fire, as we did on this occasion, it's worth cooling them. So we did hose down all of those horses that arrived that night during the evening and in the early hours of the Thursday morning. We cooled them. If they arrive probably 36 hours or more after the fire, there's probably not too much benefit to that. With extensive burns, these horses are likely to lose fluids, so we needed to replace those, and we gave IV fluids, so that's directly into the bloodstream to relieve, to replenish those, make sure they remain hydrated. One of the functions of the skin is to maintain or retain moisture within the animal, so if the skin is damaged, they lose more moisture than they would otherwise. The other thing they can lose through extensive wounds is plasma, so the fluid component of blood. The blood vessels, the smaller blood vessels in the skin, can be damaged by the fire. They can become leaky, so this plasma can escape from the blood vessels and then can be lost from the bloodstream. So it can be beneficial to replace that. We can buy plasma commercially, and that's produced for horses, and give that to replace that, because that plasma contains some very important proteins, and we can replace them that way. Obviously these wounds are very painful, so an important part of the treatment and the care of these horses was pain relief, and that did vary tremendously with what we needed to give these horses, and we based the individual protocol on how much pain that horse was in, but we were using some very potent drugs. We used a lot of methadone for those horses, which is obviously a potent pain killer. One of the horses was on a continuous rate infusion of ketamine, so we set up a fluid pump to give ketamine continuously. We seemed to work for that horse. Other horses were okay, some were just on bute, which most of you will be familiar with, but obviously very important, and something that we continued to do, again, probably for 3 or 4 weeks in most of the horses, and by that time we could sort of wean them off the painkillers, and they would be more comfortable. In terms of the burns themselves, what do we do to those? I think the mainstay of our treatment was to try and keep them clean, which is not that easy in the equine environment. We can't just put them in a bed and tell them to stay there, as you could potentially do a human burns patient. And then debride, so any skin that has obviously become dead, is not viable, to remove that. That can be a little bit hard, again, to assess when it's dead. There are people who suggest, leave it on there as long as possible because it provides a barrier, but often it will slough, and as we're cleaning them, bits of skin would come off and we'd trim them. And then apply ointments. Then the question is, what ointments do you apply? There's quite a few out there. We used a lot of flamazine, which is the white cream that you'll see in some of these pictures. Contains antibiotic drugs as well. And also the reason for applying the ointments is to protect, to keep the skin supple, as it were, because it does tend to dry out. But other sort of ointments could be used. We tried some honey on some of these, but just found that attracted loads and loads of ants, which were then annoying the horses, so that wasn't working for us. But of itself, honey does have wound healing enhancing properties, but just the practicality of it didn't work for us in this case. Another thing those horses need is lots of energy. They need that to recover. They also need proteins in their food to be able to repair these injuries. So we offered them high energy feeds, but similar to water, you can take the feed, you can take a horse to feed, I suppose, or you could provide the feed to the horse. But a lot of these horses were, probably because of the pain, a lot of the injuries occurred to the face, so certainly the face, the muzzles were extremely swollen, certainly for those first couple of days. Many of them weren't eating very well. You could, in theory, provide parenteral nutrition. That's providing sort of food in liquid form, which you can give IV. That's extremely expensive, certainly for adult horses, and not completely without risk. There's some complications that can be associated with that. We didn't go down that road. We could have. What we tried to do was offer lots of different food, some soft feeds as well, slurries, just things they'd like, tender love and care to get and keep those horses eating. Then I've written down antibiotics with a couple of question marks. As I said, there's not much literature for horses with burns. What there is conflicting. Some people think you should, some people think you shouldn't. I think those who have looked at it most seriously, there's probably not a lot of evidence for their use. So what did we do? Bit of both. We did use it in some horses with very extensive wounds that were a bit deeper. And one of the things we looked at was the white blood cell count, which is a marker of inflammation. Certainly if that got very low, we would be a bit worried. So we did have some of those horses on antibiotics, others we didn't. Most of the horses we treated survived, and there wasn't a difference in terms of survival between those that we had and hadn't treated with antibiotics. Just does feel a bit scary not to, but again, the literature suggests it may not be absolutely necessary. So this is one of those horses with just a lot of ointment being applied, the flamazine, and the sort of daily cleaning and applying the ointment. It took sort of 1 to 2 hours a day per horse, so very, very intensive. Quite a few of the horses initially we had to sedate them to be able to do that. We were trying to control the pain, but they still resented the wounds being cleaned and handled and the cream being applied. So very labour intensive. Luckily we had a lot of people to help us. And this is one of the surviving horses, a picture from yesterday I think. This wasn't the one that had the most extensive burns, but I think all of those areas have recovered and now has a nice winter coat. One of the other injuries that we saw, and the pattern of the burns were quite similar in most of these horses, so many had affected sort of heads, muzzles, eyes, the front, the legs and the back and tail. And certainly the eyes, nearly all the horses had extremely swollen eyelids, certainly sort of 2 days after the burns, and nearly all of them had ulcers on their cornea, so the front portion of the eye, probably as a result of the heat. It's causing damage to that. So the first 1 or 2 days we couldn't even see them because the eyes were shut, the eyelids. By the time they sort of reopened, we could see these ulcers, which we treated mainly just with ointments, so applying just a simple ointment, antibacterial ointment to the eyes. And some we did treat with a Levi's system, so this is not one of the burns horses, but you can see the system in place. So there's a long tube, which the end of which is roughly around the horse's withers, and you can inject fluid medication through that, and then it ends, there's it's a bit like a shower head underneath the upper eyelid in this case, so inject the fluid quite a long way away from the eye, because these horses don't like you touching their eye several times a day, so that way you can inject it and it goes into the eye. And this is one of the fire horses, and you can still see what remains of an ulcer there on its cornea. These do generally heal quite well, and I think of the horses that we treated, by sort of 2 to 3 weeks, the eye ulcers had healed, fortunately, and they heal without any scarring, so that was good. One of the big questions that we had was regarding the hoof. So a lot of these horses had damage, injuries to the coronary bands. You could see quite soon after the fire that these have been burnt, the hairs there have been damaged, and after several days we started seeing sort of separation of the coronary band. You can see that to some degree here. So the coronary band has been injured, especially in this region. The separation, the hoof is coming away from the underlying tissues, and we were concerned what this would mean, for these horses as we went on. So as I said, we spoke to a lot of people. We spoke to people in Melbourne who sort of dealt with the big fire there a couple of years ago, and a lot of the horses they developed laminitis. So obviously that's a very serious complication, so that's something we were worried about. Was that going to happen in these horses? And potentially if that separation gets even worse and it stays, it could happen that at some stage the hoof will just drop off. And obviously that also is a very serious complication that realistically requires the horse to be put down. Nobody could really tell us if that was going to happen, what to do about it. So that's a bit concerning. One of the things that we did when these horses came in, we iced their feet. So we used fluid bags that we had cut open, we put them around their feet, put ice cubes in there, and then taped them at the parson, and replace the ice every couple of hours to keep the feet cold. That's been shown to help prevent laminitis if you do it in a phase that laminitis is developing. And so we thought, we'd try and do that to prevent laminitis. We don't know what effect it had on that sort of separation of the hoof wall. One of the differences, I think, potentially with the fire victims in Melbourne is that we got the horses quicker. So we were icing the feet sooner after the fire had occurred. None of the horses we treated developed laminitis, luckily, and all of the hooves sort of reattached and by now have returned to normal. I don't know if that's because we iced them, but if the same situation happened again, I would ice them for the first 36 hours. It seems, didn't harm them, and it may have protected them. So that's one of the things we did. After that, after we took them off, what we did to those coronary bands is to try and keep them clean and dry. That was the main thing. So we'd apply just loose bandages, change them daily, see what's going on, clean them a bit, and then rebandage them just to avoid some of the shavings or the cardboard that we use as bedding getting in and irritating that. And the other thing that you can do, and we did, is add biotin to the horse's diet that promotes hoof growth and horn quality, but you do need to feed that long term for the full effect to become evident. So just a series of slides from the same horse. So this was a couple of weeks after the fires, but certainly you can see some of the separation here at the back of the coronary band, and it was quite severe. So if the horse moved around, you could see that sort of moving, and you could see the layers underneath the dermis, which should be covered by the hoof wall. So that was a bit concerning. The horse went home. This is beginning of January. Now you can see that there's reattachment of the new hoof wall to the coronary band, and this is the old hoof. And this sort of series of pictures also demonstrates again, the speed at which the hoof wall grows. So it grows about 1 to 2 centimeters per month. So that way you could work out how long this was going to take, and it has taken until now for that to be for that to return to normal. So this was a bit later in January. This is February, and obviously you can see the portion of new hoof is obviously getting bigger, and this is the old hoof, which is still sort of over the top. There is this sort of groove here that you could look into, but the new horn is growing down quite nicely. Move on to April. So again, nearly the whole hoof is normal, nicely attached coronary bands, the hair is growing back, so that looks good. Middle of May, and it's just this kind of old band of old hoof that's still lightly attached to it, and then very recent pictures where that old hoof has nearly dropped off, and what will remain is a new hoof. So that has taken 6 months, but in all of those horses that they have recovered, the hoof wall has reconnected to the coronary band, and luckily none of the hooves have fallen off, and none of them developed laminitis. Another thing to consider in the heat of the moment as well is any other injuries that horses may have sustained. Obviously it was a very dramatic event, and our main concern is for the burns themselves. We were worried about the hooves, the respiratory issues, but it's important not to forget any other injuries that can occur. So here are 2 examples. The one on the left, more cosmetic than anything else, but potentially this one on the right, just over the knee, over the carpus, that could be a very serious injury. And if you don't examine the horse or don't investigate that further, that could prove to be very problematic and potentially have devastating effects. So why do these wounds occur? Well, in part because of the nature of the horse. The horse is a prey animal, so if it's in danger they flight, or they show flight or fight, but if they can, they flee. They try and run away from danger. So they're very fast animals, so usually that works. In case there's anything in their way, they just try and run through that. So they will run through fences or any other obstacles. So if you happen to be in the way, you might get run over. And I think that's probably happened. So they probably went through fences and damaged themselves. One consideration, certainly with a wound like this on the knee, is to determine if the joint or another synovial cavity, such as a tendon sheath, if that's involved, because that's a serious complication that would need further treatment. Luckily, in this case, the joint wasn't involved, but that does need to be assessed, and the prognosis of those injuries need to be considered as well. It'd be very disappointing if you treat the horse and the burns get better, the airways get better, but then you have to euthanize the horse. It's got a life-threatening injury somewhere else. So you need to inspect the horse and take that into consideration. And this one luckily resolved as well. And then finally, related directly to the fires, is the airway issues. And there's basically 2 mechanisms by which the airways can become injured. So there's smoke inhalation smoke and or ash, and thermal damage, just the heat of the fire, which can damage the tissues of the airways. So how can we best evaluate that? Is by endoscopy. So I'll show you, and get it to work. This is endoscopy. This is sort of day and a half after the fires. I appreciate you're probably not very used to looking at these images. This is one of the horse's throat. So you can see it's all very irritated. There should be a light pink colour, so it's far too red. It's also quite swollen. There should be more room there. And we're about to go into the trachea, so the main air pipe of the horse. And obviously that should be very clean on the inside. And in this case we saw all of this black sooty material. And we'll pass the endoscope all the way down the trachea as far as we can go. So we've got some of this fluid that certainly shouldn't be in there, and a lot of this black material that's obviously been inhaled. This is about as far as we can go with the endoscope. This is where the trachea splits into two main bronchi, one to the left, one to the right lung. But the trachea, as far as we can see, has got this black material in it. Obviously that's not very good for the airways. That will cause inflammation and will interfere with the gas exchange. So what we did with that, we followed these horses up, and some of them didn't have such serious injuries or debris in their airways. Others managed to clear that themselves quite quickly, and one or two horses we gave them a helping hand. See if I can just jump along a bit. So here again we've passed the endoscope, so we're looking in the airways, and so some of this material is quite fluid, and so we're able to aspirate that, to try and take out any of this goo or gunk, to use a not very scientific term, that's causing irritation. But so we were able to aspirate quite a lot of that. But then we still had all of this black stuff attached to the trachea all the way around. So with that, we move to the right spot, a little bit further along. Get back just a little bit. So what we did, we thought we'd help the horse. And so again, we've got past this smaller tube down the endoscope, and then we're flushing. So we're flushing all of this black material as much as we can. We're flushing it. So you might think, well, they're just flushing it down towards the lungs, but we're not putting it into the lungs. So we are washing this material further down the trachea. But before it gets to the lungs, the trachea reaches its lowest point. So all this fluid was accumulating there. So we've passed this tube further down, and then we're again aspirating this fluid that we've just put in, and with that a lot of this ash and black material. And I think we spent about half an hour to 45 minutes on the horses on which we did this, and we were able to remove a lot of that material that we could see, but there might be more further down in the lungs that we couldn't see or couldn't get to. And these are just some of the sort of big syringes. These are 50 ml syringes, so we were able to remove a lot of this material from the lungs. So what do we do in terms of treatment of these airways? So for the most severely affected horses that had trouble breathing, and that we had seen this sort of black material, we provided oxygen. So that's intranasal. So we see this also got several tubes going into it. So there's fluids going into its bloodstream via this giving set, and this tube here going into its nose. You can see that better here. That contains oxygen. So again, for the first 36 hours for a few of these horses, around 8 to 10 litres per minute of oxygen to ensure, because the absorption of oxygen will be impaired, so to make sure they get enough oxygen. So that's the first thing we did. And then further treatment. So some of these horses we flushed the airways to try and remove the debris or the ash that we could. And then there's a number of medications that we can provide. So we treated these horses with bronchodilators, so that's drugs to increase the diameter of the airway there's a number of different drugs that do that. You can give them intravenously, or you can give them by inhalation, which is what we're doing here. And the other thing we did with this mask was what we call nebulization. So we did that. We can give medication via this route, but also just saline, so salty water. We put that into this container here, and then it's turned into a vapor, so very small droplets, which are then inhaled by the horse. They enter the airway, and because the particle size is very small, these droplets of water or salty water go way down into the lungs, and the idea is that they help remove some of the material that might be down there. So this horse would fairly happily just breathe in this vapor. Take about 15-20 minutes for all of that to vaporize, go in, and then we'd give the drugs by that same route to help clean up the airways, widen the airways so the horse could breathe more easily. Then again, same questions: do we need to provide antibiotics to these horses? And we did to quite a lot of those with severely affected airways. The airways are never sterile because they're open to the outside environment anyway, and the lungs and the airways are designed, if some particles get in there, for the body to remove that. But in this case, there's damage to the airways, and also there's systems in place to remove particles, so we needed to help. If there's a lot of that sort of black material, there's potential for pneumonia, so lung infection to occur. So we did treat a lot of these horses with antibiotics to try and prevent that. Steroids, another potent anti-inflammatory drug. So, for some, you could argue that you want to suppress that inflammation, but it also reduces the immune system, and that could put the horse at risk of secondary bacterial infection. So we didn't use steroids initially. We did in some of these horses a little bit later. So that's the combination of medication that we use. Since the fires, we've seen quite a lot of horses with respiratory infections, subjectively more than we would have expected to see this time of year. And then it's the question, are these related to the fires, to other things? So indirectly, certainly I think they could be. These are pictures from end of last month. So we have these obviously terrible dust storms. So these ongoing issues with the respiration, are they still related to damage caused by the fires? I don't think so, because I think that that should have healed by now. I think even at the time the horses went home, their airways should have been healed. One of these badly affected horses that I showed you the endoscopic images of, that horse has gone home, hasn't coughed at all. So I think there has been more than enough time for that to heal. But a lot of this dust that's going around, that will continue to irritate the airways. So I think a lot of it will be related to those dust storms rather than the fire directly. We can evaluate that if we wanted to evaluate that now. We could do endoscopy, and we could do a lavage. So that's where we instill some fluid into the lungs, collect the fluid back and look at the cells, and if there's any sort of material that shouldn't be in the lungs left in there, we would be able to do that. We can offer a bit of a reduced price at the moment should anyone have horses with respiratory issues and want some further investigation of that. So this is a horse that we treated pretty most intensively for its airways, and it's recovered well, including the airways. On a happier note, so fortunately, nearly all the horses that we treated for burns survived and were able to discharge. To give you some idea, I think this was mentioned at the last meeting, so most of them went home sort of 3 or 4 weeks after the fires, some with more publicity than others. There's lots of TV cameras and stuff. Again, at this point, a big thank you to everybody who helped with that. It was certainly a team effort from my own team at Equine, but a lot of volunteers who helped, and we wouldn't have been able to do it without them. And then just briefly talk about sand colic, or sand enteropathy would be a more correct term. It was predicted several months ago that this was going to happen. Obviously there's a lot of very sandy paddocks. Now we've had some rain, grass is starting to grow, but these first shoots of grass are not attached very firmly, have very short roots, and horses will eat them, pull up the roots with them, there's sand attached to the roots, so they will ingest sand. Alternatively, if they're being fed additional roughage, if they're being fed hay in these sandy paddocks and they're eating that off the ground, they are likely to ingest some sand as well, and that will cause problems. So what are the signs that we can see in horses that have ingested a lot of sand? Obviously colic. These horses can ingest a lot of sand. At Utrecht, where I was before I came to Adelaide, we operated several horses with sand colic, and I remember one case where we opened up the large intestine and we were removing the sand, and we removed 40 kilos of sand from that horse's large intestine. Now most don't have that much, but just to indicate we can have multiple kilos of sand. So if that's sitting in the horse's guts, that's going to be very uncomfortable, so that will cause colic. Another thing that we can see, sign that we can see with sand in the intestine is diarrhea. The large intestine, one of its functions is to absorb the water from the ingester. That makes the feces a bit drier and retains the fluid within the horse's body. But if a lot of the surface area of the large intestine is covered by sand, it can't perform that function, so it can't remove enough water from the feces, so they come out very watery. And similarly, if a large of the area of the large intestine is covered by sand, it can't absorb nutrients, so that over time that could lead to weight loss. So how do we determine or confirm that a horse does have sand in its intestines? One very simple test is a sand sedimentation test that you could easily do at home. Works as follows. You just collect several fecal balls this is a rectal exploration glove, add some water and mix it up, so that mixes the feces with the water, and you let it hang for a few minutes, and if there is sand in there, that sediments out because it's more dense than the fecal material, and the fingers of the glove will fill with sand. So if there's a significant amount of sand, the whole finger will be sand, which we see in some cases. So it's a very simple test. It's not very sensitive. That's to say there's a lot of false negative results. So if you don't find sand using this technique, it doesn't mean there's no sand in there, because the sand is shed intermittently. But if you repeated this several times and you never got any sand this way, it's less likely that there is sand in the intestines. But the best way to diagnose it is to take an X-ray of the horse's abdomen, and then you can see the sand on that. You do need a very powerful X-ray machine that we have in our hospital, and this is an image in all that dense white material. That is sand. That certainly shouldn't be there. Another technique would be to listen. So obviously that's something we do as vets. We listen to the gut sounds, and in horses with a lot of sand, you can hear very specific sand sounds if you listen ventrally. So the lowest point of the abdomen. Gravity also applies in the horse's gut. So sand in the intestine, that's part of the intestine, moves to the lowest part of the abdomen. And if you listen there and you have a bit of imagination, you can hear a sound that sounds a bit like waves on the beach. So as sort of the fluid contents moves over the sand. And again, that can be an indicator that there is sand there. So what do we do about it? It seems that psyllium, in one form or another, is very effective at helping to remove that sand. So we use psyllium husks, and we need to get those into the horse. So what psyllium does, if you take the psyllium husks, when they become wet, they turns into kind of gel, and that helps to move the sand along and out of the horse. It turns into gel very quickly. So if you try and just put it down a tube, it will kind of set in the tube, making it hard to get it into the horse. So we get everything ready. So we've got our psyllium in that white bucket, we've got water, and we've got a pump. We tube the horses, so we put a tube up their nose into the stomach. We mix the psyllium with water, and then we pump, or we get one of our students to pump, and we're mixing and pumping at the same time, and then we're usually able to get it into the horse, 1 or 2 minutes before it's truly set. And ideally we do that 4 or 5 days in a row, and you can combine it with paraffin, you combine it with mag sulfate, according to which study you read, that certainly psyllium seems to help to clear the sand. So in terms of preventing and managing sand colics, the most important is to prevent the ingestion of sand, but that's easily said and it's quite hard to achieve. Certainly if you've got a very sandy paddock, you don't have a green pasture at the moment, but that is very important. So obviously it's related to management of the paddock or the pasture. If there's not enough for them to eat there, you need to provide additional feed, especially roughage, so we're feeding them hay. But if they're eating off the sandy ground, once they finish the hay, or as they're picking up those last bits of hay, they're going to ingest sand. So if it's possible, try and prevent them from eating that off of the sandy ground. So some things that may help, if there's an area that you could put down some concrete slabs or rubber matting, so that the feed's on there and not directly on the sand. Again, it's easier said than done. I appreciate that. And also, it's not really preventative, but to try and prevent the build-up of vast quantities of sand. We do recommend that during the sandy season to treat with psyllium on a regular basis. So we suggest 5 days once a month, and use enough psyllium. There's quite a few people who use psyllium and say, I give it 1 cup of psyllium a day, and that's not really enough. We're talking about 1 gram of psyllium per kilogram of body weight. So half a kilo of psyllium a day for a large adult horse. So we use the psyllium husks. That's what we tube into the horses. Obviously, you can't tube your own horses. Some horses will eat them fairly readily, so if you mix them with other feed and or some molasses, others won't. There are lots of psyllium pellets on the market, so you do need to have a look at the psyllium content of those. And again, we recommend feeding that for 5 to 7 days once a month to any sand that they do ingest to move that along and prevent hopefully the colic or the diarrhea or the weight loss. I think that was it. I've talked for long enough. I'm happy to take any questions if there are any. Yes.
What do you think about chia as mucilage?
I think it's more expensive than psyllium, but that's not a reason not to use it. I'm not aware of any sort of research that's been done into the effects of that. There are a number of papers on the effect of psyllium. So I don't know. We have fairly good experience now with psyllium, but that doesn't mean that other things couldn't work.
My horses are coming here now and being scoped, so airway issues.
Mm-hmm.
I originally went to my local vet and we did antibiotics and stuff like that. One of them came here just recently and he had a lot of mucus in his trachea.
Mm-hmm.
And the vet said to me that his carina had been damaged, which was quite surprised that he wasn't coughing. What is the long-term prognosis or outcome for that particular horse? Will he continue to not be able to cough up?
I think it's a little bit hard to predict. I think so in terms of the carina's damage, I'm not sure what they meant. Could be that's broader, blunted. There's been some literature, because that was one of the things we used to look at. It doesn't really tell us much. It certainly is not a useful prognostic indicator. So when horses have these airway issues, too much mucus in their airways and or coughing, I think it's a balance between the body's defense systems and the amount of dust that they're exposed to. And it's not necessarily dust that we can see in these dust storms. It could also be related to mold spores, which are mainly present in dry hay, straw. And then if the airways are damaged to a degree, that will make those horses more susceptible to it. So usually the solution is to minimise the dust load as much as you can. Mother Nature needs to do most of the work, but there's a few drugs that we can give to horses to help speed up the process and make it easier. So I wouldn't necessarily say the prognosis is poor. I think if we're able to change the management so there's less dust, then chances are that horse will be fine. And also, it doesn't specifically relate to these issues, respiratory issues after a fire, but for a lot of the airways, there are differences between horses and how susceptible they are to these problems. And certainly, so RAO or COPD or Hooves, different names for the same problem. There has been shown that some horses are more susceptible to that. Doesn't mean they will get that, but if they are placed in an environment where it's very dusty, they will show signs. Other horses in the same conditions, they won't. So there could be some issues there as well. Yes, Cheryl.
Just to go back to burn wounds, did you have the joints of some of these horses that have deep burns? Did you see the overgranulation or contractures?
No, we didn't. Wasn't too worried about contractures on the body of the horses. Be more an issue on the limbs, because limb wounds, they don't heal as well as body wounds. We didn't see that, no. I think looking back, as I said, I think the wounds are probably more superficial than we feared, or than they looked. Again, also based on the fact that I think in all of these horses the hair grew back, so that suggests that the deeper layers weren't damaged. I think it's very, very difficult. If you read the books and literature, say, it says what grade the burn is. Very difficult to do in horses at that early stage. Okay.
Thank you very much.
Oh.
One more thing. So why do wounds not burn? Why don't they come up straight away? Why can't you see them for several weeks?
Mm-hmm. It's mainly as the skin actually dies off and falls off. So one of the first things we noticed was swelling of the skin where it had been burnt. So that's a result of the blood vessels are damaged, so they become leaky. So fluid starts to leak out of the blood vessels into the skin, so the skin becomes thicker. Because the blood vessels are damaged and because of that fluid that exudes out of the blood vessels, the skin itself doesn't get its nutrients. It could also be damaged by the fire. So then it starts to die off, but that takes a while, and then it kind of drops off. So that whole process takes a while, and that's why I think it's hard to assess initially how large an area has been affected.
Thank you, Robin. Are you hanging around for a few minutes?
I can. There was one more, but I'm happy to take that afterwards. Or now.
It's a bit unusual. I just want to know if psychologically
Mm-hmm.
any of these will be affected.
I don't think so. We have been in touch with a lot of these owners, and certainly one of the ones that I showed a lot of the pictures and the videos of. Something the owner was concerned about as well, of that horse. Fortunately, the one horse that we did have to put down also belonged to that same owner, so that the horses would be used to being together. The horse is now fine. She spent a lot of time elsewhere while its latest property was being sort of repaired. The horse is now back at home, but there's nothing in its behaviour to suggest it has been affected psychologically. So it behaves in the same way. There were concerns or questions. Would it react differently to people or to the surroundings? But doesn't appear to be the case. Okay, thank you.
Thank you very much.